welcome to Communities in Cooperation and Interfaith Action Movement as we have our first live for our maternal health celebration. We have with us today Dr. Leslie Kantor, and we're going to have an informative session. First Lady Tammy Murphy created the initiative of Nurture New Jersey, and she has developed a strategic plan for in-person and virtual meetings with various departments, agencies, health systems, physicians, midwives, doulas, community organizations, and most importantly, mothers and their designs transformational change in the system that historically has failed mothers and babies, especially our mothers and babies of color. Communities in Cooperation, Inc., where I am the CEO, and Reverend Derek Green, CEO of Interfaith Action Movement, have created a partnership and collaboration to forward First Lady Murphy's initiative. Today, in helping to continue the progress, we have Dr. Leslie Kantor, researcher at the New Jersey Rutgers University, who specializes in maternal health. To help us create an awareness for our numerous constituents, I'm going to now turn it over to Leslie as she will introduce herself, and then we will continue in a Q&A.
Great. Thank you so much for having me and for your help and partnership in this really important work. As you mentioned, I'm professor and chair of the Department of Urban Global Public Health at the Rutgers School of Public Health. And I've just been finishing up a community-based participatory research study in which I've had the pleasure of partnering with 6 moms from Newark who then partnered with me on every aspect of the research, and we spoke to an additional 31 Black mothers in Newark to learn about people's experiences throughout pregnancy, labor and delivery, and postpartum. And we certainly have many places that the experience can be improved that will lead to real and meaningful changes in health.
Wonderful. Well, I'm going to ask you a few questions, and we're just going to have a little dialogue. If you could just answer them so that the public can gain an awareness about maternal health. So question number 1, what are some maternal health disparities for women of color in New Jersey? And can you provide examples?
Sure. So, I've actually been trying not to use the most extreme examples because I feel like they're starting to scare people. But the thing that people are hearing a lot about is the very large disparity in New Jersey in maternal deaths between Black and white women, and that Black women are 7 times more likely to actually die as a result of some pregnancy-related cause than white women. So when you see that kind of disparity, you can know that somewhere at its core, it's really about racism in medical care. There is absolutely no biological reason that should be the case. So what you start to see is the intersection of what we call social determinants of health, which we know mean that people of color are systematically excluded from certain opportunities, make less money, all kinds of things that contribute to disparities in health. But we also know that the medical system has some very, very deep flaws that we need to address.
Thank you so much. What a great answer. I've never thought about it at that level of detail, and that's going to inform our audience greatly so that they can pay attention to the things that you've noted and so well. Thank you so much. My next question is, can you provide some statistics that demonstrates this is a matter of concern in New Jersey and nationwide? And why do these disparities exist for women and infants of color?
Sure. So it is really interesting when you take the truly global view. The United States is literally the only high-income country where maternal mortality and what's called severe maternal morbidity, so very serious health problems as a result of pregnancy, it is the only high-income country where those rates have gone up in the last decade. It is not true for any other high-income country in the world where, in fact, rates have continued to go down and are much, much lower. So again, that tells you that it is something about the United States system, our lack of access to medical care, the way medical care is structured, and so on. And then what's interesting when you look at New Jersey compared to other states is, we tend to, I do public health, so I look at data all the time, and we tend to see our worst indicators in the southeastern United States, except when it comes to maternal health. And all of a sudden, there is New Jersey in the top 5 for having the worst maternal health outcomes. So that is always surprising to people. But, I think I've certainly learned from lots of other leaders, and especially Black leaders in New Jersey, that we have this idea that somehow things were better in the North, and that isn't necessarily the case. That in fact, there's a really terrible history in New Jersey, as in other northern states, around disparities in opportunity. And that's what's led us to be where we are today.
Well, that is wonderful. Well, I'm just so honored that we get a chance to do this in honor of First Lady Tammy Murphy, who wants to change that and make New Jersey one of the safest and most equitable places in the nation to deliver and to raise our children. So thank you for that. And with that being said, I'll go on to our final question. To share this information, we are targeting communities of color in northern New Jersey, particularly Essex and Union counties. What are some best practices, and how can they connect to services in New Jersey to meet maternal health needs? And how can they obtain information for increased awareness in advocating for themselves?
Great. So for everybody who has a chance to see this, I wanted to send you to just 2 resources. There are many, but these are kind of one-stop shopping, if you will. So newarkmom.org is one place where a lot of resources are getting pulled together. And the other really great resource is partnershipmch.org. So that's partnership, and the MCH is for maternalchildhealth.org. There are a number of organizations in this area that are really working to change all of this. And there are a lot of policy changes that are important. So I'll name just a couple of things that I want everybody in your network to know about. So one is doula services. People may have been hearing about doulas. So these are people who are trained to actually help people throughout pregnancy and to be there as an advocate at labor and delivery. And it was once something that it was like rich women could have and nobody else could have because you had to pay for it out of pocket. Now that is covered by Medicaid. So if you have Medicaid in the state of New Jersey, you are entitled to doula services. Another really important thing to keep in mind is that the way that medical care happens, and we all know this, right? A lot of times medical providers, they're overscheduled, they're understaffed. And what we heard again and again in the study that I just did is that women felt like they weren't being listened to and their concerns weren't being taken seriously. You need to get heard. And I don't like putting responsibility on Black women themselves. I really don't. I want to change the system, and we're doing a lot to try to do that. But in the meantime, if you feel like a provider is not listening to you and you're having a hard time, talk to someone else at that hospital, in that medical practice, and say, I'm still worried about this. I still didn't get my questions answered. I still don't understand why I'm supposed to take this medication. Whatever the question is, we all know our bodies the best.
Yes.
And, I understand I'm a little sympathetic. I'm not super sympathetic, but I'm a little sympathetic to doctors who, it may be something that's very routine and normal in pregnancy. And that's why they say, oh, don't worry about it. But, for all of us, maybe we're pregnant, never, once, twice, three times, it's not going to feel routine to us. And we do need to make sure we're taken care of. So one of the things that people will find on newarkmom.org is something called the Hear Her campaign, which is a national campaign, and it's encouraging providers to listen to pregnant women. But while we are working on getting providers more sensitive and more likely to listen, we all also will need to speak up.
Well, I tell you, that is very, very interesting. You know, one of the things that I always find interesting is that when I go to the doctor and I have my scheduled visit, it's not until I write things down that I want to remember to discuss with my doctor. There's something that happens that I think it's kind of common amongst anybody who goes for a doctor visit is we forget what we want to say once the doctor enters the office. So by having, you know, it documented, written down on a little index card or just in your phone as a note, it's always good to have everything that you want to discuss while there, and make sure that you do it before you leave, that you have the answers to the questions that are needed. I tell you, Dr. Leslie Kantor, I can't thank you enough. You have simplified this information just enough so that people can grab a hold of it and to begin to practice and to make changes and to have another level of understanding. I'm so glad for the information that you provided with the Newark mom.org if they want to find out more information or to have more just understanding and connectivity to these services, as well as partnership. Was that HMP? I'm sorry, partnershipmch.org?
Yes.
Okay, yes. So we've got that, and we thank you so much. And if anybody wants to join, Hear Her, you know, that is an organization in Newark that you can also join to also have that opportunity to gain more information. And then, of course, the doulas. Don't forget about that. I think with your bringing this to us, I think that that gives us the opportunity now to say that we've completed our assignment, and you've done an excellent job. I cannot thank you enough. And together with myself and Reverend Derek Green of the Interfaith Action Movement, where their mission is to service those who have no voice, the underrepresented, the underserved individuals in the state of New Jersey. And it's a collective organization who works together to make information like this known, as well as Communities in Cooperation, Inc., where we have a 501c3 faith-based organization where we provide community services to the people in the state of New Jersey. And so we're especially going to share this with our women who are in reentry. We have some who are expectant moms, and this will serve them well. I want to thank you for your time. I also want to thank Dr. Terry Lassiter of Rutgers Health, who connected us and made this happen. So on today, on behalf of our viewers, we want to thank you, Dr. Leslie Kantor, for your expertise, for your sharing, and for your time. And may you richly receive the rewards of just all that your wishes would entail, just because you have a heart to share. Thank you so much.
Thank
Bye-bye.
you.
Hello, what an amazing interview with Dr. Kantor and Pamela B. Jones, the CEO of Communities in Cooperation. I am Dr. Tremaine Jones of Thetabar. I am the Minority Community Health Specialist with Communities in Cooperations. And one of the biggest takeaways for me was advocating for yourself. You know your body. You know when something doesn't feel right. Speak up for yourself. You have the power to do so. And I'm so grateful for this conversation as we continue in this movement. We also ask that you would share this with your network or people that you know who are pregnant, and allow them to hear all of these wonderful resources that are available. If you missed them, we're going to share it on the next slide. Also, if you want to comment and let us know how this has impacted your life, or if you learned anything today. Thank you so much, and stay tuned. Have a great day.